we'll see how it goes. The internet seems to not be behaving with me today, but today I want to talk about elbow and hand pain, most specifically the ulnar nerve, which can be a culprit for both of those. So the ulnar nerve, you might know as your funny bone, or, when you hit that elbow, you get that tingling all the way down to your hand. It can be a really, really painful situation, depending on who you are. But the ulnar nerve is kind of tricky because of the way it sits and the way it runs. And so when we think, it really isn't that funny. It's not the funny bone and what we're looking at with the ulnar nerve, when we look at all the nerves that run your neck, they go all the way into your arm. It is the lowest portion of the nerves, of all the nerves that run from your neck into your arm and hand. And so what happens is that nerve is susceptible to a couple different things. We have the muscles kind of in the front of our neck here called our scalenes. And there's three of them. They sit kind of like a fan. And in between the last two, all the nerves that come out and run down into our shoulder and down our arm. Okay. And so what happens is that the nerve can get impinged at any point. And so if the nerve gets pinched in the spine coming out of the neck, you might get nerve symptoms. If it gets pinched where those scalenes come out, you might get nerve symptoms. If it gets pinched down at the elbow, you might get nerve symptoms. And so our job as physical therapists is to kind of figure out, A, where is that pinch happening? And B, does the nerve even play a role, I guess? So when we're looking at the ulnar nerve, as it comes out through here, it actually crosses underneath the collarbone and then in between the collarbone and this first upper rib. And that's an area of susceptibility because you basically have these three fan muscles here. You've got a bone here and you've got a little itty bitty triangle right through there. And so if anything gets too tight, that triangle gets narrow and that nerve gets pinched. And usually it's what we call an elevated first rib. That first rib gets pulled up, the scalenes run down and attach to those top couple ribs. And so the first rib gets pulled up, that nerve gets hit right there, and basically you'll get symptoms down the arm, much like if you were to step on a hose, where the water's coming out might change its flow. We have a saying in the clinic, if you squeeze a cat by the tail, where does the sound come out, right? So that's position one where it can get impinged. You might know that sometimes it's thoracic outlet syndrome. Basically, that whole thoracic spine area leads to impingement. And with the nerve, you have a vein and an artery that travel right next door to it. Like a highway, they pack all the good infrastructure underneath it. Same thing with the body. It's very efficient. But if it gets pinched, a lot of other things get affected as well, unfortunately. So moving down, as we come out underneath here, we get underneath the armpit. All the muscles of the shoulder and armpit here can get tight and cause impingement running down as well. And then we have what we call the funny bone, where the ulnar nerve comes through here, we call the cubital tunnel. If we have really tight forearms, or if we have a tight tricep, or the joint of the elbow mainly bends and straightens, but at a little point, it does move a little bit side to side. And if we have limitations in that movement, we can cause impingement on that nerve, leading to pain down the arm and to the hand. And when we look at the arm and the hand, that pain usually follows that path of the nerve from the elbow and comes down into these two fingers and come in here. So a lot of times patients, when we ask, okay, where is it numb? There's a big difference between these fingers and these fingers. And so when we're looking, we say, okay, it's these two fingers, and they don't have to be numb all the time. It might be painful more than numb, but that's going to give us a sign that, hey, there's probably ulnar nerve involvement with that. And so then the last place it can get pinched is right at the hand through here, through this ulnar tunnel through here. And again, if you're typing, if you're on a keyboard a lot, you kind of end up with a double crush, or maybe even triple crush is what we call it, where there's 3 points of contact. Number one, the elbow resting on your chair can cause symptoms into the hand because you're resting on the armrest. So we want to be cautious of that because that sustained pressure over time, very much like if you lay down on your arm and then you go to move and it's like all tingly, sustained pressure decreases blood flow to the nerve, which in turn decreases output. Long-term implications of that could result in like tissue death and things like that. So we want to avoid that. Same thing with typing or any sort of kind of manipulation of the hand. If we got pressure kind of where that ulnar nerve runs into our hand, same rule as what the elbow might do. So we might see that kind of pressure happen at that point. When we're looking at the point up through here, posturally, if we're narrowed through here, that can limit the amount of space and lead to symptoms. And then if we look at chest breathing, these guys, these scalenes, are what we call your apical inhalers. They're part of a chest breathing system that should kick in when we're at full exertion. They should be there, but really they shouldn't be there when we're just resting quietly. And unfortunately, a lot of us have shifted to more of a chest breathing pattern over time. And that can be problematic, as if we're breathing here 10 to 20,000 times a day, depending on us, that can tighten that, narrow it, and bring it up here. So then the availability of movement overall might be somewhat limited. So if you're getting symptoms into the hand, arm, elbow, particularly with some sort of static positioning or pressure, it might be that ulnar nerve involvement. There's lots of different ways PT can help. We could do some dry needling. We could do some scraping. We could do joint mobilizations. It really kind of depends on that assessment. We find out, okay, where is this most limited, and then go from there. And usually it's a combination of all three of them. There's not like one size fits all situation. But then also we want to get you some exercise that you can be doing to kind of modify and help prevent down the road. So if you guys do have any questions, please reach out to us. We're at 480-786-4969. We do have a free discovery visit. And that basically is you're sitting down one-on-one with one of our therapists just to chat about, hey, this is what I have going on. And then we'll jump into basically a full assessment and say, okay, yeah, this is what I'm seeing, and this is how we can help. And we can kind of go from there. And whether we're the person for it or if we need to refer you out somewhere else, you'll at least get some answers. And of course, that's always free of cost. So appreciate you guys jumping on with me today. If you guys do have questions, do let me know. And hopefully we'll catch you on the next time as you can. So have a great weekend. Make good choices out there and take care.